Matrescence is this neurocognitive developmental phase. It's like adolescence for moms, and no one's talking about it. We don't get this type of preparation, but during this phase, your brain changes rapidly, fine tuning and priming itself for new learning. It sheds useless neural networks, so it gets rid of what you don't need to attune to your baby. But your identity changes, your psyche changes, your hormones change, your body changes.
Welcome to the Wealth Podcast, Off With Your Coat, a podcast on women's health and wellness where we flip the script and ditch the surface level chatter. We need to ask the real questions. Let's get back to storytelling and back to basics to help us uncover how to set ourselves up for true health and wellness and pass it on. I'm Kat Duff, founder of GenWell, the women's health advocacy brand building wealth, the intersection of health and wellness. Some days it's me and a doctor, coat off, talking about what really matters. No fluff, no filters. Other days, it's East meets West, trading tools, not punches, to help move women's health forward. We're building generational wealth. Come with us. Coats off, let's go. We have an incredible conversation today with Dr. Nikki Pensak, a clinical psychologist and author of Rattled, How to Calm New Mom Anxiety with the Power of the Postpartum Brain. If you are thinking about getting pregnant, are pregnant, postpartum at any stage, or treating patients that are postpartum, you need to listen in. Dr. Nikki is just one of those people who makes you feel instantly understood, and she shares evidence-based information in a digestible way for us to harness this incredible period of growth. And my favorite takeaway, we're rebranding the term mom brain. With that, let's welcome Dr. Nikki to the podcast. Dr. Nikki Pensak, Off With Your Coat. So we are so thrilled to have you, the author of the book Rattled. I read this book and I could not put it down. I think from a personal experience of postpartum, navigating like even the perinatal aspect of pregnancy, and the way that you're looking at the brain and how to harness the power of that is so incredible. So we're thrilled to have you on the podcast today. So where we begin with all of our guests is we ask you to take your white coat off, really dive in from your personal experience, talk to us about one health challenge or experience that you've had that surprised you as a woman. Maybe in this case, it can be postpartum related. Have at it, Dr. Nikki.
Oh, well, thanks for having me. I'm so excited to be here, and what a great platform. I'm so thrilled that you're doing this. So I'm a clinical psychologist, but one thing that really surprised me in my health journey, as I speak about in Rattled, is really postpartum, because I was an expert at the time in treating, caregivers, right? To help them manage chronic stress. I was developing a whole program of research and, an expert in treating anxiety and depression. And I thought, wow, like I would be immune somehow to postpartum. And then I was just so surprised. I was rattled, right, when I actually went through it. And I went through it twice. The first time a little more mild. The second time I was really in full-blown crisis and went from rock bottom to thriving pretty quickly with like great treatment, and also taking my own advice for managing mental health in the postpartum period. And then as a researcher, I went back to the research and found out more about what's going on in the maternal brain. And I uncovered a story that's not being told that really everyone needs to hear. And I was like, I need to get this information out there, because if I'm this expert in mental health that really suffered postpartum, like what is going on out there? It's like the wild,
Right.
wild west. And I was
Right.
like, I need to get the information, the evidence-based information out there. And so that's really what inspired Rattled, and such a surprising experience for me. I have shifted a lot into focusing on maternal mental health, which was not where I started in clinical psychology. So, yeah, it
Where
really
did
changed
you
my
start?
life. I started in medical psychology. So, I worked with patients with advanced illness, with burn injuries, with cancer, with transplant. But I do think that it really prepared me well to work with mothers, because at the time, It was the caregiver stress management intervention I developed and was researching
Mhm.
and still research, was focused on stem cell transplant, and the caregivers have to take care of the patients and basically, the patient doesn't have an immune system after the stem cell transplant for the first 100 days, and so it requires really round-the-clock care, and I sort of had this aha moment epiphany, right, when I became a mom and when I was going through postpartum, I was like, "Wait, mothers are really the ultimate caregiver," and everything that I learned working with patients with real physical limitations, right, with real constraints, but really unpacking that, teasing that apart, and helping them, even in the midst of, like, very, difficult challenges,
Mhm.
really prepared me for working with mothers and for getting through this and for, understanding how do we help mothers thrive even in the context of a very challenging developmental phase, becoming a mother, taking care of littles, right? So, I think all of this just really prepared me for this specialty in working with mothers.
Yeah. The concept of putting your oxygen mask on first, especially as the caregiver, is something that is we talk about it all the time as women. Oh God, I have to do my self care. I have to take care of myself in order to be a good mom, a good partner, a good friend. But seldom do we actually know how to get there. So I love what you're doing in terms of just taking evidence based practices and research and sort of drilling it down into layman's terms. I always say, like, I'm the layman, I'm trying to get women all of these resources, but in a digestible way. And you've definitely done that with Rattled and your TED Talk and what you're doing on social media. So thank you for doing that because no one is talking about it.
Yeah.
I'd love to hear a little bit more about your personal postpartum experience for the first pregnancy and then like how that differed in your second.
Okay, great question. So with my first pregnancy, well, first of all, I had hyperemesis both times, so that was
Mm,
also surprising
yeah.
and so challenging, right? So
Yeah.
I was really, really sick for, like, 8 months. I had my babies early, by the way. But the first time postpartum, I had pretty significant anxiety, and postpartum OCD was sort of subclinical. It was enough to engage in therapy and treatment and do all the things, but I didn't need medication at the time. I sort of was able to get through it with that and doing the behavioral strategies, the exposure and response prevention. Um, and so, but I had a ton of new mom worries, both that were like pretty common, but also like got to be pretty, I would say like subclinical OCD, right? But I was, hyper vigilant about the baby. It was a huge adjustment. I was like, nobody prepared me for this, right? All the preparation focuses on the baby, and then like you're left to sort of figure it out. And it differed kind of wildly from my second one because my second one, I had hyperemesis. I delivered, 5 weeks early. My son was actually in the NICU for 5 weeks, and then, 2 weeks after he was discharged, we were on COVID lockdown. So this was March of 2020. My
Yeah.
husband is a physician, he was working on the front lines, and I was just really terrified about this COVID thing, right? Um, and so I didn't sleep for 5 days straight, which I didn't know was physically possible. But I was just so scared and worried. I was like, "How am I gonna keep my baby alive? How am I gonna protect my family? What if something happens to me?" This is when we knew nothing, right, about COVID. It
Right.
wasn't even really on the news
Hmm.
yet, like, because my husband was getting these updates from overseas saying it's, 2 weeks away, it'll be hitting
Right.
the US, and then Seattle, and then, it was in Greece at the time, and so it was really terrifying for me.
Right. It's this
Um,
looming anxiety that was coming for us.
I felt it
Yeah.
brewing, and I sort of went through it in real time, and I was, like, diagnosing myself on the way, and then after, the 5 days of no sleep and sort of really being terrified, I reached out to my psychiatrist, which, by the way, I hadn't taken medication before at the time, but I do what I tell my patients to do, and I set up my postpartum village. And so I texted her from my closet in tears. I was like, "I need to I'm ready. I need to go on
Yeah.
medication. Like,
Yeah, flagging. I'm
I
ready.
need like relief yesterday. And so because I had that set up, she was able to call in the prescription that day. I was able to get relief very quickly. I was sleeping, that night, honestly, um, and really feeling a lot better. And then I also, had my therapist on hand that I had just continuously worked with, that helped support me through that. Yeah, I was at really rock bottom. And
Yeah.
then I remember, getting rid of, like, any social media, news. I was like everything was silent on my phone because I didn't want to be, triggered in that
Mhm.
way for, like, a couple months. And then, finally, I found myself on the other side, which I felt was a very short period of time to go from, like, rock bottom to really feeling my best in the midst of COVID. I was, like, thriving. I was, um finding newfound meaning and purpose in life. I was, like, enjoying playing with my kids. I mean, we were on lockdown, and I was, like,
Right.
living my best life.
Right.
And I was like, "Thank God for good mental health treatment," but
Right.
also, like, wow, I also think, you know, understanding more of, like, what the maternal brain goes through, really taking advantage of the neuroplasticity, and I think
Mhm.
therapy went that much further, but also I was engaging in, like, a lot of self-care, but also activities for me, like, I was painting, I was writing Rattled, like,
Yeah.
creative outlets, but, just really, like, prioritizing my mental health.
Yeah. That's incredible that you were able to get through that so quickly with obviously all of those proactive measures in place. I what resonated with me in the book when you were talking about, your son being in the NICU and you asking when the baby was being discharged for the baby to stay in one more night. Solely because you were nervous, you didn't want the baby to get sick, and you were already in that sort of instinctual process of protecting your baby because you didn't wanna bring the baby home and for them to possibly get COVID, which I completely understand. I mean, I was pregnant during the pandemic in Manhattan and did not go outside for 2 months,
Mhm, mhm.
which, I've had a psychiatrist for 20 years, and she was like, "This is not healthy, you need to get outside." But a lot of people don't have that care team in place to help them have a baseline and then guide them through this process. Um, I remember, and a big reason why I launched this podcast and Gen Well was I was like 2 weeks postpartum in New York, and I remember sitting outside at one of those makeshift restaurants during the pandemic with my newborn. This was September 2020, and my husband, and just verbal vomiting.
Mm.
I say venting, he says talking at him, but just telling him everything of, "Okay, no one told me about mastitis. No one told me that I wouldn't see a doctor at 6 weeks, and the only thing that they would tell me is that you're cleared to have sex, that there wasn't pelvic floor therapy, that there wasn't any mental health preparation." And it really enraged me. And so that kind of fueled, where we are today and just helping women to get to the right resources, and so again, thank you for being that. Which brings me to sort of this whole powerful concept of matrescence and what is it? What do we need to understand about it, and why does it matter?
Well, it matters a lot. So, matrescence is this neurocognitive developmental phase. It's like adolescence for moms, and no one's talking about it.
Yeah.
I mean, we don't get this type of preparation, but during this phase, I mean, your brain changes rapidly, fine tuning and priming itself for new learning. It sheds useless neural networks, right? So it gets rid of what you don't need to attune to your baby. But your identity changes, your psyche changes, your hormones change, your body changes, like
Just like
every
little things,
just a little thing.
just
This
the
little
little
thing
things.
that and I'm like, we have so much, information about adolescence, like, pretty much everyone knows, to prepare the parents and, teens, like, they go through this really difficult phase of adolescence, but it's also an incredible time of neural development, and you wanna nurture this process, and we have a lot of support around that and a lot of education. And I was like, we need that. And my goal with Rattled and, talking about this is that we really need that for mothers. We need everyone to understand so that we can nurture this process because it is so profound. And the research is telling this story and, as coming from academic research, and I love what you said about translating it to layman's terms because that was very intentional for me. I'm used to publishing in academic journals, nobody's reading that. And, they're not the ones my peers who are reading the academic journals don't need this information, right? The layperson needs good quality information. And with so much information overload on like social media and TikTok and brief snippets, like, it's, like, oversaturated, and we really need to be signal,
Mhm.
and so not noise. And so
Right.
I love what you're doing with Genwell, and that was certainly my mission with Rattled as well.
Yeah. The social media piece too, it's like everything is being catastrophized.
Mhm.
And I mean, God bless the whole trad wife thing. Like, we don't need another thing that is telling us that perfection is the way to be as mothers, and that is the route. I mean, I hope some people see the satire in most of it, but a lot of times, like, it's just adding to that mom shame, mom guilt, um, expectations that shouldn't exist. And so, um, going back to just like the overarching matrescence and how we can prepare women for that, what are some of like the more tactical things that we can do
Mhm.
in pregnancy to start preparing ourselves for that postpartum?
The most important thing I recommend is really setting up your postpartum support village,
Mhm.
right? So, having a therapist that you establish care with, potentially a prescriber, even if you don't think you'll ever need medication, because we do have a maternal mental health crisis in the US, and so we're not catching enough women. And so unfortunately, the onus still falls on us to sort of set up our support. And so if you have it ready to go, you don't have to scramble last minute to try to find a provider. You don't have to wait 3 months for an appointment. You can have that team ready. Like I said, I texted my doctor, that day for my closet, and I want it to be that easy for mothers because when you're in the thick of it postpartum, and not saying you will get postpartum, I mean, just matrescence in general is such a big transition that I'm not trying to like say that all postpartum is, pathology or that we have to like be alarmist about it. But at the baseline, I think having that set up so that if for some reason you do have this roadblock that gets in the way, you can get it taken care of quickly, right? As quick as possible, and then move on to this wonderful developmental phase and to reap the benefits of it. So all of the wonderful, brain changes that occur and really enjoy this, as much as you can, right? In this really challenging time. And so that's really my goal is to provide this roadmap in order to do the most amount of good for the most amount of people, I do recommend that postpartum support village. And I also recommend shift sharing, figuring out some support at night because sleep is so protective, right? And that will buffer against, um, a lot of mental health symptoms. And so the more you can set that up proactively, either talking to your partner and shift sharing where you can protect a solid 4 to 5 hours of sleep consistently every single night after you have the baby, that will really buffer against a lot of the stress that's going on and having that conversation ahead of time and preparing to have that shift share for 3 months. I think
Mhm.
psychologically prepares you
Yeah.
of like, "Okay, we need to protect this sleep as much as possible for 3 months." And even if you're breastfeeding, you can still do this
Mhm.
because you can have your partner, whoever's helping out, bring the baby to you. You can breastfeed, but then they take the baby and then change and do burp or do all the things, and you can go back to sleep. Or, you can sort of be in twilight while you're
Yeah.
breast.
I think that's something that I wasn't prepared for. I feel like my friends had utilized baby nurses. And so I was like, okay, I need a baby nurse, but I didn't really understand as a breastfeeding mom what that would look like. And to your point, there are so many other things that could be helpful and useful. We had a nurse, and I understand that's a privilege, but again, you can use your partner. They really should be doing that in general, but just coming to get me. And I was able to sleep because I didn't have that sort of anxiety of like, okay, am I listening? If the baby's breathing, am I hearing all of those cues or cries that the baby's actually still sleeping? but they're just always super noisy. So that is really protective. I understand that part. Another thing that was um, confusing and slightly alarming to me with my first was that I didn't understand that there were baby first hospitals and like mom first hospitals. Um, and so my psychiatrist at the time was like, "Hey, I want to be connected to your OB so we can have an active dialogue about your support," which I think is incredible, like triangulating around a mother's support before the birth happens. And then I remember my doctor saying, "I'm going to write you a letter and put it on your chart so that when you get to the hospital, they will actually allow your baby to go to the nursery overnight so that you can rest because you have a higher risk factor for developing postpartum depression and you need that rest." I'm thinking, like, what do you mean? Like, I'm just going to ask them to take my baby in the nursery and then bring the baby to me when I want to nurse. That seems pretty straightforward. No. And sure enough, I'm postpartum. It was the middle of the pandemic. My husband was forced to leave overnight. So I just gave birth at 9 p.m. It's now 11 p.m. I'm by myself with this newborn. I don't know what I'm doing. I'm like trying to get to the bathroom by myself with, my diaper on. And um, the nurse just looks at me and she's like, "No, we're going to keep the baby here." And I was like, "You, like, I
Really?
I need some support right now. And like, tell me why that is the case." And there's just not a dialogue around that. So sure enough, I said, "Look at my chart." She saw the letter, she apologized, and my baby was able to go to the nursery. But why is it such a fight to have that support for mothers? It is mind blowing to me. I
Well,
understand skeleton crews, it's COVID. There may not be support in that scenario in the nursery, but in general, why is that a thing?
wow, that's an incredible story. I hope that's more unique to COVID. Um,
I
but
Yeah,
yeah, but okay, so let's unpack that a little bit. Why is it so hard, right, for
yeah,
mothers to just get for everyone to sort of orient around the mother and take care of the mother and what the mother needs, and sleep should really be top priority, and yes, having the baby in the nursery does help, obviously it's your choice, as a mother, if you want the baby in with you, fine, but what I would say is that you're psychologically attending to that baby 24/7 the minute the baby is born, so having the baby in the nursery provides a little bit of psychological relief from that, so you can rest and restore, right? And so that's really helpful because otherwise, like you said, you had a baby, you're like, "Oh my gosh, I'm responsible for this thing, it's overwhelming." And so, yeah, I'm sorry to hear that. And, it's not uncommon that things every mother has a story, right,
mhm,
about
mhm,
something like that where it was just, you know, surprising that they weren't the priority, right?
right.
Yeah.
But I
And
think it goes back to what you were saying about finding your village.
Mhm.
I would text my doctor, like, having those relationships with clinicians, and that, again, can be a whole multitude of folks. Like, for me, my village that I had created was, um a lactation consultant. It was my psychiatrist. It was my OB, 2 OBs actually, one that I had previously that had retired. And so just having folks that you can go to in those moments, but that are also proactively looking after you. And I think the lactation support personally is something where we don't talk about that. And breastfeeding challenges or feeding challenges add so much to postpartum anxiety.
so much.
And I'd love to hear your experience in the hospital, but when I was in the hospital, the lactation support was sort of like they're kind of in and out. You're in that delirium where you're not really grasping at it. And so I always say to my friends, if you can get a lactation support or a lactation consultant to your home within the first couple of days, it's so incredibly helpful, and they're also weighing the baby to make sure that they're getting enough milk, so it sort of takes away that anxiety of, "Oh, is my baby getting fed enough?" Or maybe you can even let them go a few more hours at night because they are getting enough food. There's so many different nuanced things that we don't talk about, so I'd love to hear maybe what your personal village was and what you recommend to women.
I mean, hindsight's 2020, right? That's
Yeah.
why I wrote the book, but the breastfeeding challenges were so monumental for me. The first time I kind of expected it to happen naturally. It was like, "Oh, you're
Yeah.
just gonna breastfeed your baby." Like, no one talked about, like, things that could happen, and then when I was home with the baby, first of all, the pediatrician told me, because she was 4 weeks early, my first, that I had to feed her around the clock every 3 hours, and I could not she could not miss a feeding, right? And I was terrified. And
Yeah.
so but the problem is that my baby also had jaundice, and
Mm.
so I would feed her, but she would become very tired, and I had to keep waking her to get her to keep feeding on my breast. And then and then the feeding took so long that it would literally start going into the next feeding, and I'm like, "Wait, so I'm supposed to keep feeding her because it has to be every 3 hours and around the clock," and I was so stressed out by that. I was like I remember I was doing, like, all the different holds, like the football holds and the nipple guards. I was doing anything to try and get her to get through feeding, and eventually, I ended up just pumping around the clock until she got a little older and I could just, put her on the breast easily. And the second time, I actually made the decision proactively. I was like, "I'm not gonna breastfeed. I'm just not." Um, I it was too stressful.
Yeah, good
uh,
for you.
I went into it thinking I'm gonna formula feed, but then in the hospital, my son had to go to the NICU for 5 weeks, and the nurses came in. I remember I was, like, day 3 postpartum and baby blue central, and she told me, if you could breastfeed, um, that would be really helpful because your baby's in the NICU, and this is best for his immune system. And I remember bawling
Yeah.
because it wasn't part of my plan, and, like, I like to be flexible, but I was also, like, baby blues at the time and had this idea in my head that, like, for my mental health, I wanted to just do formula. But anyway, also, when I was going into the NICU, I kind of felt helpless, right? So I was going in and I was like, "I can't really do anything for him for this time." So I adjusted and I ended up breastfeeding and pumping and really being there and, like, really getting into it and feeling like, "Okay, at least I can do this for him." I didn't know he was gonna have to be in there for 5 weeks. And so
Yeah.
I thought maybe, like, just a couple. They kept saying, like, "A couple days, he'll be fine." Um and so it did end up working out for me in that sense, but then when we were discharged, I kept going a little bit, but then COVID happened and I was, like, very stressed out. So I ended up doing a mix, of formula feeding. But all of those things, like, how much is first of all, when I first started breastfeeding, how am I supposed to know how much my baby's getting,
Right.
right? I didn't know to weigh the baby at home or, like, no one talked to me about that, right? And so that was really yeah, I just felt much more comfortable pumping because I could see in the bottle that and this was part of my anxiety, right? I
Right.
needed to, like, see exactly how much my daughter was getting
Right.
to feel reassured.
Right.
But, like
Which is so relatable.
yeah, yeah, and I was so anxious about it.
Yeah. So that's a good segue into just mental health in general. Like, what is the difference between baby blues and clinical anxiety or depression?
Mhm. Right. So, I get this question a lot and I love to answer it because a lot of people think, oh, like baby blues, like if they're a couple weeks out, and they're still feeling like emotional and crying all the time and whatnot, that it's part of baby blues. But actually, baby blues only lasts a couple of days. And if you're going through, if you're having crying spells, if you're feeling down and hopeless, more than 2 weeks or after 2 weeks, then you're in the postpartum anxiety, depression category, right? And, like, I'm not saying, like, that means that's the diagnosis criteria, but anything outside of the 2 weeks after having a baby would be more in, like, that realm. It's not baby blues anymore.
Yeah.
And so with anxiety, with depression, it's on a spectrum, right? It's like how bad does it get? How often are you feeling it? Does it interfere with your ability to bond with your baby or to, you know, be present, or is it just really, like, just so distressing? The issue I have with all of this is that we give moms a whole diagnostic checklist, right? This, and we're expecting moms to diagnose themselves. And that really frustrates me because clearly, like, mothers will do anything, like, will suffer through so much before really reaching out for help or they're like, "Oh, this is a normal part of, like, mother martyrdom, like, this is supposed to be challenging." They'll try anything to feel better on their own, and I also work with a ton of high functioning moms in my practice where it doesn't look like clinical depression, like, you're not laying in bed all day because you have to take care of
Right.
a baby, right?
So
And
what does
so
that look like? Is it focusing on the details? Is it, like,
yeah, so
measuring success in a different way? What's that sort of
right,
high functioning?
there's a lot of, like, perfectionism, there's a lot of cognitive distortions, like black and white thinking, like, "I have to do it this way," rigidity, but they're not feeling as good as they could feel,
Yeah,
right? And so, it takes a nuanced provider that knows, postpartum and perinatal psychiatry to really be able to scratch the surface and see that in the high functioning population. Which I think is part of the issue of why we need to get more resources out there, and change how we think about, assessing postpartum because okay, so what I was getting at is that I wanna take the onus off of mothers to diagnose themselves. If you're feeling off, I mean, the bar is low. If you're feeling off, if you're feeling like you're not something's, not right, you should be enjoying this a little bit more, go make an appointment, talk to your village, talk to your OB, talk to your pediatrician, just talk to your talk, and get an objective provider to assess you. Like, you don't have to do that job. You have so many
right.
other jobs, and we as doctors wanna do our jobs. We wanna take care of you, and we can give you that objective feedback and tell you, "Okay, this is in the postpartum anxiety depression realm, postpartum OCD realm, or this is more high functioning depression and anxiety where it wouldn't reach clinical levels, but you're definitely, suffering more than you should. And I think we can unpack this and help you feel better."
Yeah. I see it as a non-negotiable, and I would argue even having that care team in place, and I think you even talk about this in your book, like, once you pee on that stick, it's like, okay, calling in the troops,
Mhm.
grabbing everyone together because you should have an understanding or they should understand a baseline, for those who haven't been in any sort of therapeutic, um, environment, like, you do have to give some background to this person that is working with you so that they can understand and assess what your baseline is versus like how they can help and treat you. So doing that all ahead of time, I think is just part of the preparedness and like simple things like I was asking my psychiatrist postpartum this go around of, hey, it's 3 weeks postpartum. I consider myself to be high functioning. I'm feeling really anxious about measuring my success at this moment. Like I'm always goal oriented. And so she was helping me sort of understand, okay, your baby is safe, you are breastfeeding, you are taking care of a toddler and doing all these things and sort of recontextualizing. And what I think you're doing as well is trying to reframe what that looks like. I just think it's so important also with like perinatal depression, which isn't talked about. So having someone that can help you during pregnancy identify, hey, are there some things that are off that can be tweaked before I get to the postpartum stage? And what you were talking about with like the diagnostic or not diagnostic, but like the scale that we are used to self assess one another. I remember being in the pediatrician's office again during the pandemic, but first time mom, I'm sitting there trying to like figure out a football hold, sitting with the pediatrician, like shaking, trying to breastfeed because my baby is hungry and trying to get my scroll of questions off to the pediatrician. He's asking me questions. And then they slip this piece of paper in front of me, the Edinburgh postnatal depression scale, and like asking me these questions of like, have I been anxious or worried for no good reason?
Mhm.
What the fuck is no good reason? I have a new child. It's a global pandemic. I don't know what I'm doing and I'm trying my best. What does that mean? There's no context, there's no nuance. And I'm expected as someone who is doing this for the first time to do that. To your point, it's a non negotiable to have that village. And, I would love your opinion on, in addition to the village, because that's such an outdated model,
Mhm.
one, why are we still using that? And two, do you have a thought on how we can, supplement the sort of village in the postpartum process?
Yeah, great question. I mean, there's a lot there, right?
Yeah.
So I completely agree with you that I do say, once you pee on that stick, set up your postpartum care village just because we're not catching enough women. And also, you're right about a lot of the work that I do with pregnant women, or just families that or beginning to plan for family planning, is talking about your own unique mental health risks, right? So there are people that have no history of mental health issues and then only experience it postpartum, right? Or you're more at risk if you have a prior episode of depression and anxiety before, in your lifetime, right? And so if you have, bipolar, there's another set of risks. If you have a family history. And so the reason that you would want to set up this postpartum village and establish care prior is because they can do a thorough baseline assessment. They can get to know you before you have the baby. They can get to know you even before pregnancy, but also during pregnancy. And you're right. Yeah, a lot of perinatal mental health conditions are actually diagnosed in pregnancy as well. You can experience depression and anxiety. It doesn't have to just be postpartum. And so it's good to have that set up and in place. Also, some mental health conditions are a lot, you can treat it easier, faster if it's diagnosed early on, right? The earlier we can diagnose depression, the better we can treat it. What's interesting is that postpartum OCD, if you only experience it postpartum, it's 100% treatable, curable, whereas OCD in general is not curable. It's treatable, right?
Mhm.
So, okay. And then with the Edinburgh assessment, I don't wanna, like, throw it out completely because it can act as a screener, but I think every mom knows that when they filled it out, they're going 0, 0, 0, 0, 0, and they may
Right,
be, like,
because 'cause you're
having
anxious.
active,
You
right?
don't want I mean, yeah, like,
Right.
there's fear in that too, right? If like,
Yeah,
"Oh, are they gonna take my baby away if I
exactly.
give a
Right,
10 like, on
right.
one item?"
Right, exactly, because mothers are still afraid of reporting their symptoms for
Mhm.
fear that they'll be viewed as unfit or the baby will be taken away or that something's wrong with them, and so to fill it out in this screener is, not ideal, but if it does capture some women, great, but absolutely we need more updated assessments. I mean, there's 4% of research funding goes to women's health issues, and pregnant women have been excluded from research studies, for forever, and so we need more research in this area. We need more validated assessments. Until that happens, right now it's about really having multiple eyes, multiple assessments at different time points. Even at weaning, we spoke about this offline, but setting up your village appointments to you know be to coincide with like when you start to wean and then throughout the process because that can be a big trigger for postpartum and that can happen. You can wean at 6 months, at 8 months, a year, even longer. So, like,
Yeah.
there are multiple touch points that we need to be assessing women and talking about this. And also husbands, you know, partners can experience postpartum depression as well.
Well,
Yeah, so I think also a good touch point for men and partners is in the waiting room, right? While the primary caregiver is getting, checked out, someone needs to be talking to the partner in the waiting room and maybe assessing for postpartum as well. So there's a lot that we can do. And I say this in the book, I say this a lot. Until that, I said, we're going to have fantastic research on maternal brain plasticity, by the time I'm old and gray. I do see the field, blossoming in
yeah.
that sense. But mothers need information yesterday. And so my goal was to really get that solid where we are in the state of science now out there to the layperson in a digestible way, and a way that they can utilize now, right?
Mhm.
Until we have, advancements, in more of this research and it becomes more well known, widespread.
Right. We don't need any more money thrown at erectile dysfunction. It needs to come over to us.
Exactly. Exactly.
So let's talk about some of those tools and tactics that we can utilize for postpartum depression and anxiety. Again, we need to be our own advocates. and make those decisions ahead of time. I love in the book how you sort of say you separate the person from any sort of mental health disorders in postpartum and sort of saying like, "Oh, my brain likes to do this thing postpartum," which I
Yeah, that's
thought
my
was really
favorite.
great. I love that because it's not like, "Oh, I'm doing this. I'm not doing this." I also loved how you pointed out, like, writing yourself a letter to sort of taking out the mom shame of everything because I do this a lot now. I'm a year and a half postpartum with my daughter, with my second, and you focus on like, "Oh, what didn't I get to? What did I miss out on today? What am I where am I not spending the right energy?" Versus like, "Oh my gosh, I did this list of 7,000 things plus my mental load." And just being kind to yourself and the way that you position it as like what you would write to a friend, I think is so thoughtful.
This was very intentional in the book, so I set it up to be a roadmap where, I provide, like, the narrative and more of the background, but then I also give, like, these snapshot boxes that have the very tangible, specific strategies that moms can use and partners can use to sort of manage different things like mom shame, mom guilt, mom rage, baby bonding, relationship changes, and protecting your marriage
Yeah.
before, after, and key takeaways so that busy moms, they can just open up to a certain page and go through some of the strategies and make them very simple. Everything that I put in the book and that I practice is evidence-based, so the research shows that it's effective and sort of gold standard treatment. And so what I know you have a lot of clinicians that listen, but also for the layperson, evidence-based treatment is a lot of times counterintuitive to what we think, right, we should be guiding mothers and parents to do. So, I explain that in the book, in terms of, like, behavioral activation for depression, cognitive behavioral therapy plus exposure and response prevention for, postpartum OCD, anxiety and avoidance, and how, we can do more approaching and nurturing through that. But just to really be informed about what, you tell your patients, and also, some things that we think might be intuitive might actually, um, you know, do more harm than good in terms of treatment.
Yeah. Well, going sort of doubling down on the treatment aspect. So something that helped me this go around, I had a harder time postpartum with my second. Um, and I was very nutrient deficient. And I think that aided in a lot of my anxiety postpartum. Um, I think less than 10% of women are actually screened for nutrient deficiencies. Do you ever work with primary care providers, or do you have any sort of personal experience on the nutrition side that you could talk to?
Absolutely. I mean, every time I see a patient, they have to have a recent medical workup, right? And, look at all those things, but in conjunction with the primary care provider or whoever is treating you, because you want to rule out any sort of, iron deficiency or something that could be contributing to mood. And a lot of the things can actually mimic mental health symptoms.
Yeah,
So, yeah, I do work closely with medical teams, and as a provider, I always wanna see that so I know that what I'm looking at.
right. Yeah, I mean, it's like 90% of women are depleted in magnesium, B vitamins, especially vitamin D, iodine. Also, asking your provider to get a full workup of your thyroid, including antibodies, which is not done. They'll just look at TSH and be done. And that is such an indicator postpartum for autoimmune, for example. Like we have all of these time periods, especially in a female's, health longevity landscape of puberty and then pregnancy, postpartum, perimenopause, menopause, where we have these spikes and autoimmune is so prevalent and no one's checking that. And so I was actually able to address my antibodies. I had like high thyroglobulin antibodies this time around, which were giving me a whole slew of symptoms. But I was able to address that with a little bit of like gentle gut
Mhm.
help. Um, But so that's one thing that is so interesting, and I think women need to get that full panel. The other part of that is the medication, which you brought up earlier. What would you say to a woman who is hesitant to take an SSRI or medication for their anxiety?
So, I mean, I work closely with prescribers, and I would say that it's another tool,
Yeah.
and sometimes you really need it. And I will make strong recommendations if I believe, like, so you may be the expert on your life, I'm the expert in treatment. So I may advise strongly to get a consultation or to talk about medications with a provider. Um, Now, certainly, I bump up against this all the time. Patients come to me and they're like, "I don't wanna take medication," and I'm usually pretty on board with collaborating with them and seeing them through the process. So funny, I had a patient like this yesterday, and I'll sort of toe the line as long as I can, but if there comes a point where I feel like, "Okay, this actually really needs, like, more intervention," then I'll, more strongly, bring them along. But of course, it's like, every patient has their preference. And there are a lot of great evidence-based treatments in therapy that can help, treat the postpartum anxiety, the depression, and whatnot. It just may take a little longer. And so it just depends on how quickly you want to feel better. And also, the research shows that in the beginning, medication and therapy have synergistic effects and really work well together. If you are feeling so bad that you actually can't make use of the therapy, then what medication can do is give you that boost so that you're able to make use of the strategies and do the treatment. Because if you can't do the treatment, then it's not going to help you. And then in the long term, actually, evidence based therapies outperform medication because you're learning the skills and strategies long term to sort of manage whatever it is that you're working
Yeah.
on. So, it's a huge conversation. I talk to my patients about this all the time. It comes up all the time. And yeah.
Yeah. And you offer so many great emotional coping skills and tips in the book. So I encourage all women to read through that. One that I particularly was interested in is when you were saying if you're reading a magazine or a book, you circle all of the A's to sort of get your mind off of if it's intrusive thoughts or anxiety. But sort of going back to if we were going on the SSRI route, so I actually stayed on like a low dosage of Prozac during my pregnancy. I think it's so important to work with providers like you who are collaborative, that are listening and saying, okay, you don't want to be on medication. Well, let's focus over here and not pushing it. I think that's where a lot of the confusion is with women, or where they may feel more hesitant because they're not with the right provider who is listening to their hesitations or needs or desire to, for example, myself, I have PMDD, premenstrual dysphoric disorder. I don't wanna bump up my dosage before my
Mhm,
period.
mhm.
I wanna do some other alternatives,
Right.
coping mechanisms to help myself. And so, what I think is really a detriment to women is, you know, health communications like when the FDA is now, putting a review on SSRIs in pregnancy and just talking about the risks of the medication and not the risks of untreated anxiety and depression postpartum. Can you talk a little bit about that, you know, conversation that's happening?
Yeah, I wrote a whole op-ed piece that was
Yeah.
published right when that came out. I'll send you
Mhm.
the link, but it goes
Yeah.
through all of that because we do need to talk about the risks of untreated depression and how, that can be even worse than, we have a lot of solid research, decades of safety
Decades.
research in psychiatry. And so a lot of the medications are very safe in pregnancy, even in breastfeeding, right? There's only one that I think is like a hard no, it's like a Depakote. But anyway, you work closely with providers, and we do have a lot of safety data to reassure women that, their medications, if they're on it, that they don't necessarily need to stop it. Because I think even well-intentioned providers that just don't, know or maybe have biases
Yeah.
can be like, go, oh, just go. It used to be the advice was, "Oh, yeah, you're pregnant? Okay, just go off your medications." And now it's like, "What?" It's a vulnerable time period for instability, and that would not be. the recommendation. It's much more nuanced than that. And so I think it's important that we don't give mothers another reason to feel guilty, right,
Right.
about taking care of their mental health. And, I was furious, with that announcement and panel that was clearly biased. And we need to keep talking about this in a way that reassures mothers because we do have a lot of great safety data out there.
Yeah. And the fact that, the mother's maternal health, mental health is the key indicator for health of your children. And so taking care of that proactively is so important. And going back to that care team, I, I cannot impress on women enough that should be someone that you're collaborating with and that is not speaking at you. It
Right.
takes a long time to get to the right therapist as well. So doing that ahead of time at least gives you that runway to find the right people and finding that village.
Yeah, it's like
Um,
dating, and so you might have to try a couple, and so that's
right.
being proactive about it, so you're not scrambling last minute because you cannot problem solve when you're in the thick of it,
No,
right? And
absolutely not.
so, really setting that up, yeah.
And then the amount of friends that I've actually had that had postpartum depression that weren't aware of it and sort
Mm,
of got out on the other side and were like, "Holy shit, that was really bad and I should have had some help in that time frame."
mhm.
And so when you're, you know, harnessing the power of the mom brain, I would love to talk about how we're reframing mommy brain, mom brain into a positive and not this sort of um, pathology, as you were saying before. So for those who haven't had a child before, what is mom brain and what's the stigma around it?
Well, I mean, everyone knows the stigma, right? And so I'm on a mission to rebrand mommy brain
Yeah.
because the stigma is that it's like derogatory and that it's a
Right.
bad thing. And that when you make a mistake, it's like, oh, mommy brain, I can't do something. And that it's a dysfunction. When actually, when you look at the research and what I talk about in Rattled, is that it's much bigger than that, right? And so the subjective experience of feeling forgetful and foggy and interrupted is very real, right? That is something that we do as mothers have to get used to and adapt to, and it takes time. But really, it's your brain doing this incredible adaptation of getting rid of the things that you don't need to attune to your baby. So, for example, like this is why we lose track of conversation, with an adult, right? Because
Yeah.
we'll remember exactly when we need to order the diapers, right? And so when you look at the research and you compare mothers compared to non-mothers in objective memory functioning test, there's really weak support for significant differences. And so what that means is that, even though you feel like you're functioning worse, you're objectively not functioning worse. I think it's more due to the mental load and the exponential tasks that you have to adjust to and the complete, psychological responsibility of taking care of a baby. It's just overwhelming. And so when I think of mom brain now and what I try to talk about is that when you figure out how to soothe your baby through trial and error, right? Is it colic? Is it, the formula too concentrated? Is it gas? Is, whatever it is, and you soothe your baby in that moment, you're doing this like problem solving in your
Mhm.
brain and you're rising to every relentless challenge that comes
Yeah.
up 24/7. And your brain is just exponentially evolving and getting better and better, even though it doesn't feel like that at first. That is what's happening, and I think mom brains are brilliant. We just get a lot of roadblocks in the way to reaching that brilliance or to feeling brilliant, and so we have to sort of the way I set up the book is that the first part is like, okay, baseline, it's like Maslow's hierarchy, right? You need solid mental health, you wanna set that up, right? Once that's intact, then we talk about, adjusting to all of the new mom emotions, right? Baby bonding, mom shame, mom guilt, mom rage, all of that. And then the third part of the book is really like, okay, how do we get to this exponential growth and thriving? And I talk about post traumatic growth. And really, that's to reassure women and mothers that no matter what type of experience they had in childbirth, we have a lot of birth trauma. Or how bad their postpartum got, or, maybe childhood wounds are coming out when are beginning to mother and it's bringing up all of that. No matter how bad it gets, there's still this potential for thriving and resiliency through post-traumatic growth. And I think of also becoming a mother is a normative trauma, right? It's a complete, upheaval of every system in your body in a very short period of time, right?
Right.
It's the biggest neuroplastic change that a woman will go through, in the shortest period of time. And so we can talk about that, and there are ways to sort of nurture that to really feeling your best, and really to also empower mothers that even though you feel like I don't have this or I'm not functioning at my best, like you can get to a place where you feel that way and you're a great return on investment for employers, right? There's all this creativity and brain power that's happening on the other side. And um yeah, bringing mothers along on that journey and not just surviving, right? Not just
Right.
getting through it. Because I think we are so, it's just such a huge transition and there's so much going on that we're really just trying to survive most
Yeah.
days. Um, but
Well,
also to frame how we think about it, right?
right. I mean, your cell phone is fine in the refrigerator. It'll be fine. You're focused on your baby and yourself, and then you're golden. I think, um, what are some of those skills or the benefits of mom brain that, as you in your book are talking about harnessing that neuroplastic moment that we
Mhm.
can come out on the other side with?
I think it's, like, just the relentless problem solving and being
Yeah.
creative, right? Like, I did this in I talked about it in my TED Talk, but, like, getting
Mhm.
a toddler and an infant out the door at the same time to make an
Yeah.
appointment is, like, takes incredible brain power, right?
Right.
And also, when you have multiples, you're, like, straddling a couple different developmental phases, but, like, we don't really give moms enough credit for how
Right.
much they're actually doing in any
Men
moment.
could never. They could never.
And I think about oftentimes, I'm like, I wanna do this research study where I have mothers write down every single thing they do and think about before, like, 8 AM, right? Because the list is, like, exponential and grows, and we're all over the place. We're constantly problem solving and anticipating, and this is sort of how we attune to our babies and whatnot. We're doing so much, and really just to give credit you know, uh and for mothers to understand how much they're actually doing and empower them, but also to nurture that, right? And how to apply it to across the board, right? How do you be more creative in play with your kids to sort of get that joy,
Yeah.
right? How do you harness that and know that that's like actually good for you? How do you take that break and feel like, not guilty, right, for
Mhm.
leaving your kids, but also to really lean in and double down on it, right? So that you get the most out of it,
Right.
and that'll actually improve your mood, and you'll be a better mother, you'll be more present with your kids. And so to lean into all of this and really nurturing your mental health, but also your creativity, your leadership,
Mhm.
right? Problem-solving abilities, and see it as such.
Mhm. Well, the empathy and leadership as well, I think, was a huge sort of takeaway from me, post both pregnancies. So I'm, like I said, I'm 1.5 years postpartum. When does the window close for this neuroplastic moment? Am I too far gone?
No way. No way, because neuroplasticity, talk
Yeah.
about so in the early phases of postpartum, you have a real biological push to all of these neuroplastic changes. But neuroplasticity happens all the time. It's basically just how, our brain changes. And that can be, I talk about experience dependent neuroplasticity. So your brain actually changes as you're interacting with your kid and even through these developmental phases. And I think like it just keeps going and go. I mean, we know it just keeps going and going. And so it's not like over, and if anything, it just changes and keeps building. You're still like, you're going through other challenges that you have to rise to with your kids and figure it out. I mean, my kids are like 8 and 5 now, and I mean, my brain, I'm just like I'm doing it in a different way, but the window is not closed. If anything, it's like very cerebral, and now I'm thinking about it, now I'm like, "Okay, how do I talk about emotions with my and like, emotion regulation and like
Right.
also like body changes
Right.
and friendship dynamics and all of that." I mean, the list is endless, right?
Yeah.
I just think of it as such an incredible lifetime challenge. And
Mhm.
so with that, your brain continues to change. It's
Mhm.
just this neuroplastic window early on, you get the biological push with it.
Got it.
That's really intense.
Yeah.
But it still continues.
Okay.
Just kind of teeters off.
So something I don't think people are talking about at all is this confluence of we're having babies later than previous generations and now perimenopause. And sort of are they intertwined?
Mhm.
Is there like from the neuroplasticity aspect or mental health aspect, is there anything that we should be doing in terms of preparedness or if we've had kids to sort of work through that life stage?
Yeah, I mean, I think that we absolutely need more research in this area because it's another one of those areas where it's like, there's a paucity of research perimenopause and how do we support mothers during this time? And yes, we are having babies later on. So you want to think about the hormonal changes that happen in perimenopause, the sleep changes, the stress, the anxiety, and whatnot that can come up during these windows of vulnerability. So if you add pregnancy and having a baby onto that, it might make you more vulnerable. I don't think that we have enough research where I can say conclusively exactly what, happens, but I would say it's another, opportunity to check in and to see how it's going for you and also, get a medical workup if you need it, but also to understand that you are a priority and that, whatever it is that to nurture that and to take care of yourself.
Mhm. I love that. So, just a final question to bring it full circle. So, once you pee on that stick, those top three things to put in your blueprint to prepare for
Mhm.
matrescence, what would that be?
Okay. Once you pee on that stick, you wanna set up your postpartum village, right? And have a therapist and prescriber, potentially, if you can afford it, a night nurse, but do the shift sharing, right? Talk about, the sleep aspect. Those are probably the number 1, right? Sort of setting yourself up to put your mental health at top priority, but also to buffer and keep it stable, right?
Mhm.
So that's the
Mhm.
first one. The second one is, I talk a lot about, division of labor and how to divide responsibilities and the mental load and all of that. I recommend fair play as well. Eve
We
Rodsky's work
love
is
fair play.
phenomenal. Yeah, we love that,
Have you
right?
done the game, the card game?
I haven't done it personally, but I prescribe it all the time to my patients and,
It's
watch
great.
the documentary, read the book, right? And so talk about that because it's just like there's so much to do. And I think also really understanding what it means to be psychologically responsible for a task because mothers, we're in this primary preoccupation of taking care of the baby when we become a mother. And so you want to really think about that and the mental load and how to share that with a partner or your village, right? There's just so much there.
Right.
Um, the third thing I would say is, okay, well, obviously read Rattled. But, there are ways to cope with, mom rage, mom guilt, mom shame, all the emotional changes, and just, also think about this as an incredible opportunity, right? That, you are going to be changed from the inside out. And, it can be just amazing and, relentlessly challenging at the same time, but an opportunity to sort of dig into yourself and root down and really take advantage and explore, be curious about what this next chapter is going to look like for you and that you can, get to a place of really thriving and feeling your best at times, and that it's important, really important.
Yeah. Is there one other thing, because we didn't really dive into the village and like your partner outside of the sleep aspect. Is there one thing that you would say to women to have their partners do or look into or just to be aware of in that postpartum period, either to look out for with anxiety or depression or to help them in a way that really is meaningful in this matrescence?
Yes, I mean all of that. Basically. I think open communication, right?
Mhm.
Partners really, you talk about what's going on. Have a series of difficult conversations, what you're noticing, and, try to get it out there. Talk as much as possible because I think um, that will help. And you're both sort of going through this beginner stage when you become new parents, right? But then even when you become a parent the next time or you have multiples, right? Like you've never done it with more than one. And so to be comfortable being curious and being a beginner again
Yeah.
at moments and that you're not doing anything wrong. You're not supposed to know how to do this. Maternal instinct is a myth. And, you can talk about the hard things.
Why is maternal instinct a myth? I love that.
Oh, because it's really about a series of trial and error and problem
Mhm,
solving and
mhm.
figuring it out. It's not like, oh, you're just born with it and like eventually you have a baby and it's like, oh, you just know exactly what to do. It's actually just relentless trial and error and figuring out your baby. That was the most important thing that I thought about when I had a baby. I was like, I didn't read a lot of books because I was like, intuitively, what I did know intuitively is that I'm gonna have to learn my baby. And I'm not saying books can't be helpful. They are. They're very helpful. But, the maternal instinct part of this is it's not that. It's learning, and it's
Yeah.
trial and error and figuring it out on the job.
I think that's so profound. I love that. It just gives women it takes the pressure off.
Please. I mean,
Awesome.
come on. I know, and we're
Um,
supposed to we like the culture is that it's all supposed to come naturally. It's like, no, that is
right.
not that's just harming mothers because every mother feels like they're failing when
Mhm.
something challenging comes up or, the baby's crying inconsolably, we take it like, "Oh, we failed at this,"
Oh,
um
yeah.
and it's just the pressure is just relentless, and so I
Mhm,
wanna normalize that maternal instinct is a myth. We know this, and it is trial and error,
mhm.
learning on the job, and rising to every relentless challenge.
Yeah, I love it. You are such a joy. I love chatting with you, and I could chat for, several more hours. So I would love to just do a quick fire round, and then we can wrap it up and tell people where you can be found. So, what is one wellness trend that you found on social media that you actually leaned into?
So I don't know if I found it on social media, but I will say that I rediscovered it. Being of a certain age, my algorithm has somehow keep feeding me videos of like weight training and lifting and heavy, all of that. And I used to do that a lot prior to having kids. But when I had my kids, I was like, I don't really want to do strenuous workouts anymore. Like I've done enough. But now my kids are a little older and I'm back into and being of a certain age, right?
Yeah,
Perimenopause ish
25.
that? Yeah,
Yeah,
25.
yeah.
It's gotten back into the really rigorous, strength training workouts, which I actually love
Cool.
again. So,
Awesome.
yeah.
What's your favorite personal care product?
So I love the Biossance oils at night, like the squalane oils. I literally drench my face in this oil, and I have
Okay.
very sensitive skin, so, like, whenever I use other oils, I tend to break out. I have to be really careful, but for some reason, Biossance, I literally just, like, drench it on my face, and then I wake up, and it's like it's like my skin is so thirsty.
Oh, yeah, I love that. Okay.
It's like
Great tip for the
it's
winter.
amazing, and I don't break out from it, so that's what I love.
Love. All right, last thing you Googled or asked chat.
So we're hosting Thanksgiving this year, and I am trying to figure out what am I gonna cater, what am I gonna order, where am I gonna order from because there's just so much to do and whatnot, so that's what I've been Googling.
Yeah.
Yeah.
I love it. And podcast, book, or resource that you would recommend to women in addition to Rattled?
Right. So actually I was just on another podcast, Healthful Women, and it's by this Dr. Nathan Fox. He was the co-author of The Unexpected with Emily Oster, but he's also in the medical field and is a expert OB, but he has the same mission to sort of translate the science and the highest quality information to the layperson. So definitely check out Healthful Women because it's a lot of, evidence-based, practical and entertaining, right? It's not like a dry doctor's podcast.
Great. Yeah, we don't like the dry ones and the yeah.
No, we need more
No.
entertaining, like, doctors podcasts, like,
Yeah.
Doctor does a great job, we need,
Yeah.
like, we need way more of those
Health
for
and
mental
wellness,
health.
it could be fun. It doesn't have to be dry and just
Right.
like so didactic in a
Yes.
bad way. So
Yeah,
totally.
yeah.
All right. So where can people find you? Buy Rattled, listen to Rattled, and then anything else you want to plug?
You can buy Rattled wherever books are sold, support local bookstores, or, you can get it anywhere. It's also on Audible. So, like, if you're like me, I can only listen to books now or I fall asleep. But so you can get it there. You can find me at Dr. Nikki Pensak on Instagram. And if you do read Rattled, I love to hear feedback. I love getting the emails, no matter what, objective feedback, whatever. I just, love hearing from the readers and whatnot. And then if you are a clinician or provider, I also provide case consultation. It can be a one-off or it can be ongoing. So feel free to reach out to me if you want to understand more about how to work best with your patients or clients. I'm happy to consult for that as well.
I love it. Well, thank you so much for an incredible conversation, Dr. Nikki.
Thanks for having me.
Thanks.